Ruvini?
Hello, Kisaliaka. Can you hear me?
Okay. And අපි චුට්ටක් බලමු තව මේ
හරි හරි. මමත් මේ දැන් ආවේ.
ඒකට ඕන PowerPoint එක දාලා පොඩ්ඩක් ඕන චෙක් කරන්න පුළුවන්.
Alright, okay.
ෂෙයා කරලා.
Fine. Can you see the screen?
Yes, Ruvini, we can.
Okay.
Just move it and see whether it is moving.
Fine. So let's do it like this.
Yes, it is moving. Okay. Okay,
Right.
Ruvini, we'll just wait another 2-3 minutes and we'll start it. Okay?
Yeah, sure.
We can hear you, we can see you.
Fine.
Okay.
Okay.
Okay, let's see. You can stop sharing if you.
Yeah. Where is you share? Stop sharing. Can you still see that?
Yes, Ruvini, still we can see it is okay.
Is that okay? So there was
No, it
a
is
problem.
okay,
I
Ruvini.
think I can't. Okay, fine.
Now, okay, Ruvini, we can't see it.
Oh yeah, I stopped.
Okay.
I stopped sharing. Yeah.
Shall we start, Ruvini? Others will join, I think. Okay. Good afternoon to all of you, and very good morning to you, Dr. Ruvini. I warmly welcome Dr. Ruvini Ranasinghe to this forum today. I also welcome all who have joined with us today for this webinar organized by the College of Chemical Pathologists of Sri Lanka. I'm honored to have the privilege of introducing our guest speaker today, Dr. Ruvini Ranasinghe, MBBS, Diploma in Chemical Pathology, MD Chemical Pathology, FRCP PAT, is a specialty registrar in Chemical Pathology, ST8 Specialty Training Grade, and she is awaiting for Specialty Registry entry in GMC. Ruvini is currently working at Department of Clinical Biochemistry, King's College Hospital, NHS Foundation Trust, London, UK. She is involved in laboratory as well as many clinical work, including lipid and cardiovascular disease risk assessment clinic, metabolic bone disease clinic, and also she is a member of adult nutrition support team at King's College Hospital for 7 years, involving in parenteral nutrition care in inpatients and home parenteral nutrition patients. Dr. Ruvini has many research, audits and publications under her name, and out of them, many are under topic of obesity, nutrition and lipidology. Dr. Ruvini support us for our college academic activities, and I really appreciate her help, and it is a great encouragement to us. Today, Dr. Ruvini's topic is trace elements. Dear Ruvini, thank you for allocating your time for us in spite of your busy schedule. We are grateful for your presence here today, and I'm sure that this will be a valuable experience for all the attendees present in this meeting today. Over to you, Ruvini.
Muthugoda, can you hear me? I think there was a bit of a network disruptions here.
Yes,
And
we can hear you, Ruvini.
okay, thank you. Yeah, I'll start sharing.
I think if you have disturbances, you can off your video and just share the screen and do it.
These all are my slides now. And yeah, I would like to thank you, Dr. Hirimutugada and Dr. Katlan and the College of Chemical Pathologists for inviting me for this webinar. And it's a great pleasure for me to share some knowledge on trace elements with you today. So I know that trace elements, the topic seems to be quite boring, but maybe you would be able to look into trace elements in a different way if you look into them as some sort of interesting elements, interesting analytes. Okay, so just to keep you awake from here and there, I might ask some questions. I hope that you won't mind answering them. And also at the end of the session, you can ask any burning questions. Okay. As in the conservative way, I'm trying to go through these objectives like what is trace elements, what are the essential trace elements and their metabolism in the body, and what happens in deficiency, what are the supplements available, and the toxicity, and also the measurements of trace elements. So I would like to say that I'm going to focus more on the essential trace elements. Okay. So what are the trace elements? Can anyone would like to answer? Can all of you hear?
We can hear you, Ruvini. Trainees can answer.
Yeah, if anyone would like to answer, I will give you 30 seconds. Fine, that's okay. So the trace elements are the elements that we need in very minute amount in the body, that are absorbed and also present in very minute concentrations. So usually it is said that in our body, it is less than 0.01%, if you take the percentage. And many of these trace elements play a very vital or an essential role in our body. You would understand as we go along. So the essential trace elements, there are few of them are called essential trace elements. So what is the meaning of essential trace elements? Essential amino acids, essential fatty acids. That means they are important in our body function. However, it is not producing in endogenously. So we need to take them outside in our diet or any other way as supplements. Okay, so the essential trace elements I am going to focus in today are iron, zinc, sorry, it's not song, it's zinc, copper, selenium, chromium, cobalt, iodine, manganese, and molybdenum. But there are non-essential trace elements which are mainly important in the toxicology. Those are aluminium, arsenic, cadmium, mercury, lead, zinc, and other tin and others like vanadium, uranium. We are not focusing on them today because it will be very, very boring if so. Uh, so in general, what are the physiological role of these trace elements? They are actually catalyzing enzymatic reactions. They are cofactors of many, many enzymatic reactions in our body. So they participate oxidation reduction reactions and in energy metabolism. Talk about more later. And all these trace elements are toxic if you consume in excess for a longer time. That is why they are needed in very excess, it will be toxic. And also, if they are deficient, it will also affect the health. That is why they are very important, even though we are not giving much attention to it. Okay, so let's move on to the next slide. So I think that you remember periodic table. So I haven't seen them for quite a while until I was preparing this presentation. So this is actually a nice table, nice graph because trace elements in. So if you remember this from column 3 to 12, those are called transitional metals. So most elements fall in this group, this group. Those group have an electron that can be released in their outer shell and they have high melting point, high boiling point. So if you remember any from your A levels or your medical school. But apart from that, there are non-metal trace elements, which I'm going to talk about today are selenium and iodine. Okay. So what happened to those trace elements in our body? This is just a simple diagram that you can see. The trace elements that you take in the diet or supplements, they are absorbed in different parts of the intestinal tract from stomach to colon, okay, mainly duodenum. So there are specific proteins that absorb these trace elements, like divalent metal transporter for iron. So they take them into from the apical surface of the epithelial cells to the cytosol, and then from the basolateral surface to the circulation. So these transport proteins also play an important role in trace element homeostasis. Okay, so after taking them into the circulation, they can go to different cells, tissues, liver, kidney. So some of them excrete in kidney as urine, and some of them excrete as the tissues like skin cells, hair, and the trace element that goes to liver may deposit there, or some of them excrete through bile. So the main excretory pathway is the intestine as feces. They can go as unabsorbed metals, shedding mucosal cells, or in the GI secretion or biliary excretion. Fine. So as I told you, there are a whole lot of functions allocated to each and every trace elements, essential trace elements. So I have put them into a table. I know that it is very exhaustive. However, I would like to go through these one by one just to emphasize you how important they are in our body. Okay. So if you take iron, you know about iron, it is in hemoglobin, myoglobin, and it is oxygen carrier. And apart from that, it has a fundamental role in cellular process like DNA synthesis, cell proliferation and differentiation, gene regulation, drug metabolism, steroid synthesis. So most of these functions, absorption, excretion, uh, there are still studies going on. There are still energy gaps in between what is happening. with the trace elements, because the attention that is given to trace elements are not that much like in the other conditions, other macronutrients. Okay. um, so zinc is very important because it is a cofactor for more than 300 enzymatic reactions, including the rate limiting reactions of nucleic acid metabolism. So you can imagine how important zinc is, even though we are not paying much attention to that. Okay. So apart from that, it involves in immune system, neuromodular function. So copper, again, a cofactor enzymes, and copper, I think copper, iron, the iodine, those are familiar to you. Hang on a minute, there is something going on my screen. That's fine. Sorry. So copper also involved in redox reactions and involved in growth and development of the body. It has a role in metabolism, connective tissue maturation, and neurotransmission. Selenium. Selenium is forming some proteins. It is very prone to get attached to the amino acids and proteins and make about 25 selenoproteins involving, again, vital functions like thyroid hormone metabolism, redox reaction, and the the novel invention is that it protect the vascular endothelium, and also the important function is the glutathione peroxidase activity. Okay. Chromium, I think you would be able to remember that the chromium has a very important role in glucose tolerance, and it amplifies insulin signaling system, including in peripheral tissues, and it also potentiates tyrosine kinase activity, and it intervenes in metabolism of carbohydrates, proteins, and fat. Iodine, I don't want to tell anything. I think you all know its role in thyroid physiology. Manganese, another essential micronutrient, which has which, which is important in synthesis and activation of many enzymes that have that are important in body functions, body physiology. When it comes to cobalt, it is important in a way because it is a main component of cobalamin or vitamin B12. So when we talk about the functions, we are talking about the vitamin B12 function rather than cobalt itself. Okay. And also, again, molybdenum is a cofactor for three main enzymes in humans. So if we go through all these list of functions in each and every trace element, you can see that most of them are involving in nucleic acid metabolism, cell proliferation, growth, thyroid physiology. So I think you can understand how important they are in our body, what a vital role they play in. Okay, so please pay more attention to trace elements after this. So I have just listed those trace elements with bit more details just to familiarize them to you. But I know it is, so we may have about 30-second break in between them. Okay. So iron, you know about iron. It is most abundant trace element in the body. So most of them are in blood, but others can be deposited in liver, bone marrow, and muscles. So the iron level is mainly regulated by absorption of dietary iron. The sites are duodenum and proximal jejunum. So if they are a patient with duodenectomy or proximal jejunal resection, we need to pay more attention on their iron levels. Iron can be excreted through sweat, menstruation. So females have premenopausal females have less iron in their body and their requirements are high, shedding of hair, skin cells, and excretion of enterocytes. There are two main forms of iron storage, ferritin, hemosiderin. I just mentioned them just for the completeness. chickpeas, and it is transported by transferrin. And dietary sources come from two main sources like heme ions, which are coming from animal products, red meat, organ meat, seafood, and non-heme ion, nuts, beans, vegetables, chickpeas, fortified cereals, and dried fruits. So as you go along, you will understand the dietary sources for trace elements are more or less the same. So zinc. So that is the second most abundant micronutrient in the body. Okay. So most of them are bound to albumin, some are bound to alpha macroglobulin, and there's a small percentage bound to transferrin. So you would say that other than iron, there are two other micronutrients use transferrin as their transport protein. As with the iron, homeostasis is mainly regulated by intestinal absorption and the transporting protein, and as well as by excretion. So zinc is available in wide variety of animal and plant food. It should be by nature, because if I mean, as you can understand how important zinc is, we have to take zinc. So it is available in most of the food. So animal sources like seafood, beef, red meats, um, and plants, legumes, nuts, and whole grain cereals. So when it comes to zinc absorption can be influenced by other divalent minerals like copper, iron, and also like with iron, phytates, and dietary fiber. Um, as with heme absorption, I think you may remember the heme ion absorption is better than non-heme ion absorption, because non-heme ion absorption can be influenced again by phytates and fiber. And in the presence of vitamin C, it increases the non-heme ion absorption. So the heme ion is coming from animal sources. So like that, zinc also, the zinc coming from the animal sources absorb better than plant sources. Okay, so when you try to take more animal, more organ meats, seafood, and red cells, so you will get most of the trace elements. Okay, so you need to remember that there's a fine balance between zinc and copper over the time in the body. So there is a transport protein in the intestine called metallothionein. So zinc has actually more affinity for metallothionein. So if there's more zinc, there's reduced copper absorption, because both of them are competing for that same transport protein. Okay, it happened vice versa as well, because it is a competitive, there is a competition. Okay, fine. So we'll move on to the copper, the nice color metal. Uh, Copper absorbed earlier than the other trace elements. It started absorbing in the stomach, okay? Because in the stomach, there is highly acidic environment. So the copper ions from the food are released and get absorbed. And also it is complexing with other elements like amino acids, organic acids, and other chelators. So they are in a more soluble form. And copper bind to albumin, amino acids, and ceruloplasmin in the circulation. So large fraction of the circulating copper return to the liver as ceruloplasmin bound copper. The amount of copper stored in the body is small in normal state, and majority is concentrated in brain, liver, especially liver, brain, kidney, skeletal muscles, and heart. Okay, dietary sources again the same. See the animal sources and the plant sources. At least one food has everything in both sources. Okay. Selenium. Selenium is another trace element which exists in two forms, inorganic and organic. So the main site of absorption is duodenum. Absorption can be influenced by other presence of other metals like sulfur, lead, arsenic, and those are not commonly present in normal diet, and calcium and iron. So the majority of selenium transported bound to something called selenoprotein P in the circulation. Major sites of storage are skeletal muscles and liver. And selenium amount in the selenium in plant sources can be vary according to the amount in the soil. So as with the food chain, selenium in the plant go to the animals, and from animals, when we eat them, it will come to us. Okay. Chromium, remember chromium has the role in glucose metabolism. So it has several valence status. However, among them, trivalent chromium is the one that is biologically active, biologically essential. So the chromium 3 is the one we are more focusing on. It is the essential micronutrient. Uh, Other chromium valence, like chromium 4 is toxic, or they are also carcinogenic. Okay, chromium absorption is poor in the gut. Because of that in supplements, uh, it will be complex with something called picolinic acid, to make it more absorbed. So in supplements, usually if it is not complex with that, it will give in excess amount. Okay. Um, so the dietary sources, again, animal meat or plant products, grain, fruits, vegetables. So any questions so far, just to keep you awake? Fine. So we'll move on to cobalt. As I told you, cobalt is the main constituent of vitamin B12. You can see it's the main component here. So usually trace elements needed in excess doses for a longer time for them to be toxic. However, cobalt can have acute toxicity if given in large doses. So it can happen through cytotoxicity or apoptosis. And also cobalt metal and salts are genotoxic. Um, Carcinogenicity of cobalt is under investigations. There are controversial findings, but nothing given as stable state. Okay. They mainly accumulated in liver, kidney, pancreas, and heart. And the blood transporting protein is mainly albumin. Sorry. Yeah. The iodine, you know about iodine. I'm not going to describe more. So it has a main role in thyroid physiology. So the dietary sources are mainly coming from vegetables or fruits that grown in iodine-rich soil, and also some from drinking water and seafoods. And the main iodine source in the world is ocean, not the soil. Okay. Manganese, a cofactor for some of the enzymes. It is found in many industrial settings. So it's sometimes, even if you don't take them from diet, you may get them from the other sources, like it is involved in ceramics, batteries, cosmetics, leather, firewood, glass, pesticides, and fungicides. For manganese also, as with chromium, the dietary absorption is poor. Because of that, if you see some supplements like multimineral supplements, you can see the manganese comes in larger doses than the daily requirements. Okay, it also absorbed by inhalation and through skin. The diet absorption can be affected by other presence of other food like carbohydrate, phytates, animal proteins in diet. The main thing that you need to remember about manganese is that it can cross blood-brain barrier, so can cause neurological symptoms in manganese toxicity. Here, sometimes we test manganese for neurologists when they suspect some unexplainable neurological symptoms, so in Parkinson's disease. So the dietary sources, again, seafood, and green leafy vegetables, potatoes, nuts, whole grain. Molybdenum, this is the last trace element I'm going to describe in this way. So trace molybdenum, we don't have that much of data on molybdenum. We only have animal studies. So molybdenum, we need to remember that it excretes in urine. So if there's if there's some pathology going on, kidney, it may affect molybdenum. However, um, we haven't seen that much of molybdenum toxicity because they are anyway in the body in very trace amounts. Okay, so the clinically apparent nutrition deficiency is not reported. It is very efficiently absorbed from the gut. So even if you take a very small amount, almost all will absorb into the body. So yeah, dietary sources again, organ meats, nuts, grains. But molybdenum in some food like soy food are not absorbed efficiently. So after describing all these trace elements, what I'm going to tell you is it's the wonder of nature, because nature has included most of the trace element into one food from animal. Like you can see most of them are present in seafood and organ meats, and plant sources like whole grains and nuts. So even if you take small amount of them daily, you will get your daily requirements. Okay. So the trace element deficiency, I'm not going to talk about this in details, because you know now you know the functions. So then you can understand what will happen if they are deficient. Okay. So in general, they will affect your growth, affect almost everything, neurological problems, muscle problems, and especially with there are specific ones like chromium with glucose intolerance and insulin resistant, with iodine hypothyroidism. Other than that, most of them affect your growth, affect your neurology, um, and also most of them cause anemia, affect your bone marrow. Okay. Again, toxicity, you can imagine what will happen when they are in excess. But in general, with these trace elements, what happen is most of them cause GI irritations, cause vomiting, diarrhea, abdominal pain when as they are in excess in the body, or when there are toxicity. Other than that, again, that can cause impairment of cellular metabolism and affect the neuronal system, neurotoxicity. And with iodine, it's the thyroiditis, thyroid disorders. Yeah, these are the common things that have proven that can be caused by toxicity. But as I told you, there are still knowledge gaps. Okay, so this is the recommended daily requirements of trace elements. So this was given, I have taken the recommendation from ESPEN guidelines. ESPEN is the European Society of Parenteral and Enteral Nutrition Guidelines. So they have given them as DRI, dietary reference intake, that include recommended dietary allowance intake, because for some of the trace elements, they haven't set up the recommended dietary allowance. There are no enough data to develop that. So they just give something like something called adequate intake. So I have given them as DRI. So I have given them in oral DRI per day and parenteral DRI per day. So I'm not going to describe the whole table. It's a few of them I just wanted to point out. So you can see the oral requirements are higher than the parenteral, because you know the oral, not everything is absorbing. And about iron, you know, premenopausal requirements are higher than postmenopausal and male requirements. And for zinc, variable groups have given variable recommendations, like ASPEN, American Society of Parenteral and Enteral Nutrition, given something else, and WHO is giving something else. So anyway, on the ASPEN, it was given like 8 to 15 milligram. They take the ASPEN recommendation for parenteral DRI as 3 to 5 milligrams. Okay. And for chromium, for oral, they have given two recommendations, 35, and for males. For females, it's 25. I'm not sure why for males the requirements are high. Okay. Um, Yeah, for cobalt, they don't give any recommendation because it is given as vitamin B12. Yeah, for iodine, with some physiological conditions like pregnancy, lactation, the requirements are more. Anything you want to ask from this table? I don't think that anyone would talk. Fine. So I'll come back to later. So what are the trace element supplements? So there are oral supplements we usually use here for post-bariatric patients or the patients who are deprived of nutrition, Forceval, 1 capsule per day. So these are the contents of the Forceval. And IV preparations like Aditrace, we used it previously, but now we don't have it anymore. So we use something called Adavan, and these are the contents of Adavan. It comes in 10 milliliter ampule, and we used it for parental nutrition or additional intravenous nutrition trace element supplements. Also, there's another one called Nutrialt. Okay, so with saying that, I just wanted to go to this one. Sorry. So see, this is the Forceval contents, and see the requirements. See, compare and see the requirements are okay, or they are matching with the contents of the capsule. So iron 12, fine, it's given in given to the high side, copper 2, okay, and zinc 15, that's also fine. Iodine 140, it's in the lower side, manganese 3 milligram, 2 milligram, little bit higher. Manganese absorption is poor in the GI tract. Selenium 50. Selenium is, anyway, we usually give it an increased amount in IV even. And chromium absorption is very, very poor. So this capsule contains 200 microgram, whereas the requirement is like 35 for males and 25 for female. Molybdenum in 250 microgram. Its absorption is quite efficient, so I don't know, it's in excess, but we haven't seen anyone toxic, okay? And the IV preparation, this is the Adavan preparation in 10 mils. I would like to emphasize, see, most of them are higher than the requirements, but we keep monitoring because usually the IV preparations are given to either nutritional deprived patients or the patients who are who are critically ill or inward patients. So these patients have acute phase reactions, there are losses going on. So because of that, I think maybe because of that, the contents are higher in those preparations. Okay. So the monitoring of trace elements, we are following nice recommendations for our nutrition patients. So I have given that to you here. So we usually measure nutritionally zinc, copper, selenium, iron, and ferritin and manganese for nutritional purposes. We don't measure others routinely. So for zinc, copper, we usually measure baseline, and depending on the results and the supplements, we decide when we are rechecking them. And selenium also same, we check baseline for everything. And manganese 3 to 6 months if the patients are on home parenteral nutrition. You can understand why, because in those supplements, because we always add either Adavan, Aditrace, Nutrilite to parental nutrition bags daily. If the patients are on them daily, the manganese content is a little bit higher, it can be high. And there are contaminations like through needles, so it usually be high. Okay, so the main thing I need to emphasize is that all these trace elements are affected by acute phase reactions. So in acute inflammatory trauma surgery, these trace element can be affected. Sometimes it is due to the transport proteins like albumin is a negative acute phase reactant and ceruloplasmin is a positive acute phase reactant, transferrin in a negative acute phase reactant. So because of that, the trace elements can be affected. So sometimes if we have a patient, we may not be able to get the baseline if the CRP is quite high. I will talk about it more in another slide. Okay, so we go to the measurement of trace elements. So sample, we usually use serum collected into a royal blue top tube. Okay, this is the serum tube. And also we are measuring manganese in whole blood sometimes. It is collected into EDTA tube. So that's the again the navy blue top with the purple ring. Sometimes clinicians request urine, ferric, copper, which are collected into acid washed containers. We don't have counterparts for these royal blue top tubes for pediatric populations, so we use lithium heparin samples. Okay, and also another sample type is the liver biopsy where we detect copper excess, iron excess. Okay, so as a cutoff, we take CRP less than 20 milligram per liter for reliable interpretation. Um, so if it is more than that, sometimes we consider the whole clinical picture and act according to that. Okay. For manganese sample collection, I need to tell you that we usually advise to take the sample from venous catheter port or the second row sample, because otherwise if they get sampled through the needle, it can also cause contaminations. So the measurement of total trace element concentrations are doing by atomic absorption spectrometry or ICP-OES or ICP-MS. ICP means inductively coupled plasma optical emission spectrometry or mass spectrometry. So remember that we measure total trace elements. Okay. So in our hospital, we used ICP-MS. So this is one of the study I wanted you to draw your attention. They investigated on the effect of inflammatory response on trace elements and vitamins. So I have given you only the trace elements. So if you see in major inflammation, when the CRP is around 100, 200, uh, the zinc, selenium, and iron is decreased by, selenium and zinc decreased by 40 to 60%, and iron by 60 to 90%, and copper increased by 30%. Okay. So in minor inflammation, it is still reduced by we use this because we don't have any other way to measure trace elements. Okay. So at KCH, King's College Hospital, we measure selenium, zinc, copper, manganese, mainly for nutritional assessment, and also iron. Urine iron is measured in the trace element lab. Cobalt and chromium are measuring in the for the orthopedic surgeons for the patients who are on metal hip prosthesis. Aluminium are measured for nephrologists if the patients are on aluminium containing medications mostly. And the heavy metal poisoning was under toxicology. We measured mercury, lead, thallium, cadmium, and arsenic on request. Okay. So a little bit about ICP-MS. Am I on time? Yes. It is the method that, as I told you, that we measure. So you know what is plasma? Okay, I will tell you. It is a state of matter. There are 4 states of matter in the universe: gas, solid, liquid. You know all 3, and plasma is the other one. In plasma, it's like gas, but it has free electrons, it has positive ions, and free atoms or molecules. Okay, it is present in the whole universe, like in stars, sun, everywhere. But in here, what we are doing is we send a neutral gas like neon, argon through a highly heat, through a way. I mean, we take them into a very high temperature to make them plasma, to release electrons, make positive ions, and there are some stable molecules as well. So we make them plasma, and sample is nebulized to make droplets, and send those samples through that plasma to make them as ions. So the trace elements become ions, which goes through the mass spectrometry, the quadruplet mass spectrometry, and separate them according to the mass to charge ratio, and then detect on the spectrogram. Okay, so this is a short video clip. I think I have enough time. Let me show you this. Sorry about the advertisements.
This is MSJ Chem. In this video, I'll be looking at inductively coupled plasma mass spectrometry.
Can you hear that?
Inductively coupled plasma mass
We can
spectrometry.
hear, Ruvini.
Spectrometry,
We can't see anything, but we can hear.
Oh, really? Let me.
It combines a high temperature ICP, which is an inductively coupled plasma source, with a mass spectrometer. The ICP source converts the atoms of the elements in the sample to ions.
So is that okay? I mean, I don't know how to share this one.
It's okay, you play it.
Yeah,
These
sure.
ions are then separated and detected by the mass spectrometer. An inductively coupled plasma is a plasma that is ionized by inductively heating the gas with an electromagnetic coil. Argon gas is electrically heated to a high temperature plasma, to temperatures greater than 6,000 Kelvin. Plasma is one of the four states of matter.
Hello, Ruvini. I think you have to reshare this. Stop sharing this and reshare
All right.
your
Okay.
video.
All right. Thank you. I'll try to do that. How can I find that?
In this diagram, this is MSJ Chem. In this video, I'll be looking at
share screen. Where is this one? Can you see now?
in this video, I'll be looking at this is
Yes, we can see now.
Yes, we can see.
MSJ Chem. In this video, I'll be looking at inductively coupled plasma mass spectrometry. Inductively coupled plasma mass spectrometry is a type of mass spectrometry which is capable of detecting metals at very low concentrations. It combines a high temperature ICP, which is an inductively coupled plasma source, with a mass spectrometer. The ICP source converts the atoms of the elements in the sample to ions. These ions are then separated and detected by the mass spectrometer. An inductively coupled plasma is a plasma that is ionized by inductively heating the gas with an electromagnetic coil. Argon gas is electrically heated to a high temperature plasma, to temperatures greater than 6,000 Kelvin. Plasma is one of the four states of matter. It consists of free electrons, positive ions, and neutral atoms or molecules. In this diagram, the blue flame is the inductively coupled plasma. The sample to be analyzed passes through the inductively coupled plasma. Due to the high temperature of the inductively coupled plasma, the sample is ionized. Next, the ions enter into an electric field and are separated according to their mass to charge ratio. Here we can see an example of a mass spectrum. On the y-axis, we have the signal intensity of the ions. On the x-axis, we have the mass to charge ratio. The signal intensities are directly proportional to the concentrations of the elements in the sample. In this sample, there are higher concentrations of lithium, sodium, and chromium, and lower concentrations of tin, silver, and cadmium.
That's it. So let's go back to the slides. Okay, can you see the slide now?
Yes.
Yes, we can see.
Thank you. So the quality control of the trace elements in our lab, we have commercially available QC materials for almost everything, every trace elements. And the external quality control program is on the UK NECQUAS, which is called TEQUAS, Trace Element External Quality Control System for serum, whole blood, and urine samples. Okay, so I have given two cases. I think that is the end of my presentation. And the first case, actually, these are the cases that we found in our nutrition wood rounds, and that we made some interventions. Okay, so the case one is a 66-year-old male who had a complex surgical history with multiple laparotomies for dysolysis, and he had a cecectomy, and he has multiple enterotomies. Some of them are repaired. Uh, that was following a initial bowel obstruction and a laparotomy in 2009. So currently, he's waiting for an abdominal reconstruction with the open abdomen with multiple enterotomies, which are coming into a bag, like a colostomy bag. He has a colostomy also. So the output is quite high, whatever he's taking from the from mouth or orally. So usually like it was like more than 2 before, 2 to 3 when we were starting parental nutrition, and now it is like 1 to 2. So he was actually, the surgical team referred him to us because they wanted to optimize nutritionally this patient. He's taking orally, however, he's losing weight. So he's on like 4 days of week supplementary parenteral nutrition. So his baseline trace elements, when we measure, when the CRP was 12, was like low copper, low selenium, and zinc in the lower margin. That was back in June 2021. So this was the normal trace elements given to him. Sorry, I don't have in micrograms and micrograms or milligrams in these. So the selenium 400 nanomole and zinc 180 micromoles. So after about 4 months, we advised to check trace elements, but the surgical team has done that when the CRP is higher, 52. So it is a bit difficult for us to interpret this because selenium is low, zinc has now become low. Okay, we don't know whether it is the effect of acute inflammation, and copper suddenly has gone up, or maybe because of the supplement. However, we consider the matter that he has high output, he has nutritional deficiencies. So we have increased selenium to 1000. Okay. And with that, in about again 3 months, everything has come back to normal when CRP is normal. Now he is on selenium 1600, zinc 180, and his micronutrients are stable. Okay, so the second case, it is a case of manganese toxicity. I told that if someone is on parenteral nutrition or a trace element supplements for a longer time, they may end up with manganese toxicity. It is very common. So this is actually an interesting patient with a 35-year-old female. She came with extensive small bowel ischemia following a cardiac arrest that happens because of a rupture of a peptic ulcer. Okay, so she had bowel ischemia, she has brain ischemia, she had liver ischemia. So the bowels were resected from time to time until she had about 10 centimeters duodenum remaining. So she was completely parenteral nutrition dependent, and she was not medically fit for small bowel transplant. However, she recovered slowly, like her brain recovered. So while she was on parenteral nutrition for about 6-7 months, we didn't have baseline actually for manganese. So we checked her manganese levels, which came as 423 in serum when CRP was 22. So when we inquire the staff nurses, they are not sure how the samples were collected. So we repeated it in a few days' time, which came as 380. That was in whole blood. That is still high. So she was actually on Aditress 10 milliliter, which has 99 micrograms of manganese. So we reduced the Aditress volume to reduce manganese to half. And then about a month's time, her manganese it's coming closer to the normal. So we continued the same. Yeah, so I would like to emphasize the take-home messages. So these trace elements are essential. They play a vital role in body physiology. Please don't forget about that. However, both deficiency and excess of trace elements could be harmful, and the concentration of trace elements in the blood can be influenced by acute phase reaction. Therefore, we need to measure when the CRP is lower. The cutoff we are considering here is 20 milligram per liter to have reliable interpretation. However, even if you have to do it when the CRP is high, we have to consider the patient as a whole, and then we need to action on that. Okay, and also it is crucial to avoid any contamination while collecting the samples. Fine, so this is my reference. Main reference is the ESPEN micronutrient guideline. And I would like to thank Dr. Kishoraj, our consultant scientist, who is the director of the Trace Element Lab, for helping me with the slides. Thank you. And any questions? Any questions, or are you all sleepy?
No, no,
Ruvini,
today all are there.
Ruvini,
Yeah.
But
one
Yes.
question. The thing is, I was like a few times, like my internet was disturbed and I couldn't listen. But you may have told about this in your lab. Do you use? So, what are the method used for copper, zinc, and manganese?
It is ICP-MS, madam. Inductively coupled plasma mass
Oh,
spectrometry.
okay. So the thing is like it's not easy to run samples using ICP-MS. So you have you are doing this on a daily basis. So how do you manage it?
Yes, I think they are doing it in daily basis or maybe weekly, because I think they have given to assess urine in this day,
Okay.
serum in this day, like that. Because we usually get like turnaround time is like 1 week, I would say.
Sorry, I couldn't hear it properly.
What can I do? Can you hear now?
Now I can hear you.
Yeah, it's like we are getting results like within 1 week. So if the MS is working properly, we
Okay,
should get
okay.
the results in 1 week. So turnaround time is like 1 week. We do it, I think, once a week. Yeah.
Okay. Anyway, these things are not done on a urgent basis. They are not urgent tests,
Oh,
so you
no.
can wait.
Yeah.
Hello.
Hello, madam.
Yeah, Ruvini. I'm Dr. Chandrika Mingama. I need to ask one question, but I think you partially explained that. Now you said you measure the trace elements of these sick patients, but if the CRP is more than 20,
Mm-hmm.
you just, how do you set about? You said that you think about, you don't think about the levels of trace elements, but then you as a whole, you take the gender condition of the patient.
Yeah.
So the most of the time their CRP is more than 20,
Yes. Yeah.
So then this the measurement will go, like, I mean, you measure the trace elements.
Mm-hmm.
How do you set about now if the CRP is more than 20, anyway you measure them?
Yeah. For did you see the case I have given, case 1? So in that case also, when CRP was measured,
Yeah.
when trace elements were measured, the CRP was like 52. So every time when we do trace elements, we asked to do the CRP as well. So when CRP is high and the trace elements in low, the zinc and selenium low and copper was high, and the patient on continuous supplements. However, we looked at the patient's trauma output, the wound management output, which is high, it is like 2 to 3. So we know that he's losing. Because of that, it is losing. It's nutritionally deprived. Because of that, we increase the selenium in the body, in the parental nutrition supplement.
Okay.
Because
There is no way of correcting according to an individual patient.
no, madam, we don't have we haven't developed any formula to correct that. I think that would be a better prospectus in the future to do.
Yeah.
Because most of the patients are sick and it is difficult to get the
that is yeah. Okay, thank you. Thank you.
Any more questions? I think okay.
Dr. Ruvini, I'm Dr. Tatsarani here.
Hello.
Can you hear me?
Yes, I can.
Yeah, Dr. Ruvini, is there any place in trace metal analysis for children with ADH, like hyperactive disorders and autism in UK for their toxicity, the trace metal toxicity?
That depends on the clinical request. I mean, that goes with the pediatricians because we are not deciding whether we are doing this or that. So if the clinicians think that they need to do this and request us, because I haven't read any sort of data on hyperactive disorders and trace elements, but there may be new literature coming up. I haven't looked into that. Basically, trace elements were assessed against CVD risk, carcinogenicity, hypertension, and those kind of things. Yeah.
Do you get like frequent requests from pediatricians regarding trace metal analysis of autistic or ADHD children usually?
No idea on that because we mainly focusing with the adult patients, and I can look into that, and maybe if there's something like that, I will let you know.
All right. Thank you so much, Dr. Ruvini.
No worries.
Okay. Any more questions? I think it's time to end the meeting. Anyway, I will invite Tushara Hevagigana, Joint Secretary CCPSL. He's the consultant chemical pathologist to Teaching Hospital Anuradhapura to deliver the vote of thanks.
Thank you, Kisali. I take this opportunity to thank our speaker, Dr. Ruvini Ranasinghe, Specialist Registrar in Chemical Pathology attached to King's Hospital, NHS Foundation Trust, London, UK, on behalf of College of Chemical Pathologists of Sri Lanka. Thank you very much, Ruvini, for your interesting presentation. And please accept our token of appreciation, which will be sent to you very soon. I also thank all the participants who join us from all over the country. Without you, this event won't be a success. And we'll meet all of you very soon in a webinar like this. Thank you very much.
Thank you, everyone.
Okay, thank you, Ruvini.